science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born-again child of the Most High King.
Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers, and we are here live in the studio on Awesome Radio 106.9 FM. We are here every Thursday from 3 to 3:30 for Family Health Matters because we do believe the health of our family does matter. I have again with me in the studio, you may recognize these two lovely ladies who were here a couple of weeks ago. And convince them to come back to share some additional information with us on today. And our topic today is going to be miscarriages and pregnancy loss. I have Dr. Alison Swift with me and Dr. Madeline Fernandez. And they are experts on this topic. And they have done their research for their PhDs concerning this issue. And I was thinking about when we started talking about the topic, how sensitive it may be, and it may be concerning to people, and it may cause a little bit of anxiety, a little bit of stress, and may even bring back some memories for some people who may have experienced it. But I was thinking that this would be the perfect opportunity to share this information and to educate our audience on that this is real and how can we as families support women that may have experienced loss, and to be able to just understand some of the processes or some of the things that they go through psychologically, physically, mentally, just see if we can just sort of pull some things together and pick their brains and share this information on today. So I want you to be mindful. And if you need to step away from the conversation, that's fine. But I do think that this will be very helpful. And we do have an opportunity that if you want to call in, you can call in to 252-756-2008 and join the conversation. Or if you want to ask these ladies a couple of questions, they are willing to be there. And we do have some support sites that we will be sharing during this time of conversation. So I welcome again Dr. Fernandez and Dr. Swift with us on Family Health Matters because we do believe the health of our families does matter. So I'm going to let you, Dr. Fernandez, start off and just sort of share some information, a little bit of why this subject is so important to you and just a little bit about your research.
Of course. Thank you for having us here, Wendy. Again, my name is Dr. Fernandez. I'm an assistant professor at East Carolina University, and my current research is on miscarriage, specifically women who experienced miscarriage during the pandemic, which we know miscarriages is a pretty isolating event for many women and partners. And at the stress of the pandemic and isolation of being mandated to stay at home has, compounded the impacts on that. So definitely that's something that we've been looking into and seeing how we can improve the care and support for these women during such a time. And just to start off with maybe some definitions for those that aren't aware, miscarriage is the loss of a pregnancy that occurs prior to 20 weeks. If it happens after 20 weeks, the term is called stillbirth. That's when the baby is a little bit more advanced, more developed, and usually after 20 weeks, they have a greater chance of survival if they're born prematurely. But that's not really the case for those under the 20 weeks, so that's kind of where they break that up. Stillbirth, it happens about 1% of all pregnancies, so it's not as common. Whereas miscarriages, it happens 30 to 40% of all pregnancies can end up in miscarriage. So that's a much higher percentage, and so it is very common. The main issue that maybe we don't know too much about it, or we think we're in this alone when it does happen to us, is because there's this culture of keeping it quiet and hushed and not talking about it, whether it's because we're embarrassed, we feel like failures as a woman, you fear judgment or comments of others that may not know what you're going through, and that could be hurtful. So we tend not to talk about it when you do, you'll easily find one or two maybe women within your own family that have gone through it and they just haven't shared it before. So it is very common, but each woman's journey is different, and the way that that they are affected emotionally and physically and mentally through it is different. So those are some kind of background statistics and definitions to get us started. I would say, to add to that, the most common reason for miscarriages is usually genetic malformation. So it's not anything that the woman did or didn't do. It's usually something we don't have any control over. Maybe the egg or the sperm came with some genetic mutation that was just wrong from the beginning, or during the process of when the sperm eats the egg and starts to develop, one of the little cells has an error in it, and so eventually the whole system of developing the baby shuts down, and we have what's the miscarriage.
And that just sort of jump in there. I think that piece is really significant because I think when you started off, you were talking about how the conversation is not readily, something that we talk about on a regular basis, or it is kept very private.
Right.
But I think people understanding that with a miscarriage, it doesn't necessarily mean that the mom didn't do something that they were supposed to do, or they didn't eat right, they exercised too hard, or something like that. And it could just be genetics.
Right.
And I guess I don't want to make it sound like just genetics, but I wanted to make sure that you actually said that it wasn't anything that could have done different, I guess.
Right. Like I said, that is about 60% of miscarriages. Mm-hmm. The other percentages could be potentially from being advanced age, smoking, being overweight, or have increased number of sexually transmitted infections. Those are things that will increase your risk for miscarriage. And usually, if you're in the care of an obstetric or gynecologist provider, they'll cover what medications to stay away from, and what foods to stay away from, things like that. So if you're following the guidelines and you're taking your prenatal vitamins, most of the time, like I said, 60% of the time, it's nothing you did or didn't do. And the problem is that even knowing that, we tend to blame ourselves and start thinking back, like, okay, did I do this, or did I not do this, or did I do it too much? And you kind of spiral into your head, trying to find a solution, trying to find a control or something you can do next time better. But again, most of the time, it was just totally out of our hands.
Yeah. And then that's good because, like you said, spiral. And we as women, I think, and that's if you can maybe comment on this too, we are so into control or fixing things, and we want to try to fix whatever we can. And sometimes that's something you can't fix, but you can process through it. And maybe because I was listening to a podcast this morning, and one of the things that they were talking about, a woman gave an example about a miscarriage, and she was trying to work through the process. She was talking about her testimony, and one of the things she was saying that because she miscarried the first child, that the doctor came in and they did some additional research to find out what was going on. So they found out that it was genetic. There was some genetics that was associated with it, but prepared her and helped her and her husband be prepared for the second child. And they were able to do some things with her cervix and some different things to help her carry the baby full term. So she turned that around. It took a while, she said, it took a while, but she was able to turn that around to be a positive that it was a benefit to know that had she not done the research and the doctors had not found this, then she would have suffered another loss.
Yes, that's really important.
Yeah. So that's what are your thoughts about that?
Yeah, I mean, that's definitely one of the things. If you've had a miscarriage, and if you've had 2 or even 3 or more, to go get checked out by your healthcare provider, because there are tests and there's things that they can look for to help determine why those miscarriages could possibly be happening. And sometimes they find that they can't find a reason for why those things are happening. But like Dr. Fernandez says, it usually is genetic, something genetic that has happened within the baby during conception or while it's growing.
So talk to us a little bit, talk to Alison a little bit about the psychological process, mentally. How do we help our families through something like this?
So for many women, this is one of the most traumatic events that happens to them in their lives. And it has been proven in research to be associated with anxiety, depression, PTSD, even like psychosis, if it's not properly treated or caught in time, and increased feelings of isolation as well. So we know this exists. There's things that can be done. We really need to advocate for ourselves, though, and that's the issue. That's the main thing. If we are noticing that we're having these thoughts, very intrusive, self-blaming, feeling very isolated, we need to have the courage to speak up. Your provider, your partner, somebody you trust with that, because it is a very delicate situation. And again, as I mentioned, the people that haven't gone through it, they may try to mean well, but they tend to come off hurtful. They might say things like, "Oh, you're young, you'll be okay. You can try again next time." That one for me is probably one of the worst. Just try again, because you're still grieving this baby. You're not thinking about next time. You're trying to acknowledge that this baby was alive and you lost it, and you had this whole life imagined with this child, and what you were going to name it. If you knew the gender, and I mean, you're not just losing a baby, you're losing that whole future, that motherhood that you were planning for. So it's very, very heavy for a family member to say, "Oh, you just try again and have another one." Or some people might even say, "Oh, maybe next time don't do this or that." That kind of plays with your mind. Right? You start thinking like, "Oh, they're trying to say it was my fault." Right. So that's why we're trying to educate now, right?
Absolutely.
So let's stay away from those comments for someone who's gone through this experience. And really, probably the best thing you can do is really just listen to them and be there for them. And if you want to help find support groups for them, that would be some way to help as well.
Absolutely. I'm glad you said that, because that to me was the whole purpose of this segment, is to educate, because we don't want to hurt anybody. But if we're, what that's this old saying, ignorance is bliss, and if you could just learn and to think in your mind, what can I do differently? And I like what you said about just being there. Sometimes the ministry of risk presence, not always feeling like you have to have an answer. Because if you haven't experienced it, you can't say, "Well, I understand." And I think that's a mistake that a lot of people make lovingly. Will say, "I understand," and in your mind you're going, "No, you don't. No, you don't. No, you don't." Yeah. Okay, good point. Good point. Good point. Because misconceptions, So that's sort of like mentally. So if we're recognizing that we're having some depression, or the person is having some depression, what are some avenues that we can help direct them to?
So, Dr. Seth, do you want to
Sure. Well, I think it's important. Social support is extremely important when you're going through a miscarriage or a pregnancy loss. And one way that families can help somebody that they know is to acknowledge the fact that they've lost a pregnancy. Because Dr. Fernandez was saying, so many times people go, this experience goes unacknowledged by a lot of people. They just don't see, they think, "Oh, it's not, you haven't had the baby yet. You don't have that baby in your arms." So I think sometimes that loss go unacknowledged. And so if you can help acknowledge that with them, then that helps. There's, Dr. Fernandez mentioned social support and other support groups. There are a lot out there. I always have to give a plug for Facebook because it's such an easy avenue to go and find support groups. But there's others. There's an Empty Cradle support group. There's Share Pregnancy and Infant Loss Support. There's another group called Heartstrings, Pregnancy and Infant Loss Support, or Pregnancy After Loss Support. There's
actually.
Yeah.
Oh, okay. So those right here.
That one in particular covers Greensboro, High Point, Connersville, and Winston-Salem, North Carolina.
Okay. Okay, good. So what about anything right here in Pitt counties, that we could, I'm sure, we can go in and do some research and find out, and I'm sure, like you said, on Facebook, and, that's one thing, like you said, that's because Facebook, you don't have to be in Greenville to be a part of that support group.
That's
you
right.
can be wherever. So there is support out there.
Yes, and there's even online support groups outside of Facebook too. I mean, Google is a nice, useful tool to help find different things. We have counselors all over the area, so I think reaching out to a counselor or therapist is a great option to help you process all those emotions. One thing that I think can be helpful is doing different things to acknowledge that loss. So, for example, maybe you make a piece of jewelry, like a necklace or a bracelet or a ring. Maybe you have an ornament that you hang up somewhere on a Christmas tree or some other kind of place where you can put that ornament, or a statue. I've seen garden stones that can be made as well. Memory boxes, all kinds of things that you can do to help acknowledge that. There's baby naming ceremonies, even funerals, and that's okay too, and that's a good thing. Whatever you feel like would be helpful for you to process those emotions and to move forward is what you should consider.
Absolutely, that's very good, and I like that so much because it doesn't mean that it's not important, but it brings significant awareness to that important part of your life and your husband's life or the family's life, and you want that person, because it is a person, it may not be actually that you can actually see, but that is a part of you. And you have to acknowledge that it is and help in that. And I think too, another reason for it would be church. I think that's not a good support group, good ministry. That is a place that would be helpful. And I think this part of education is helpful even for just educating ministry, because if you haven't had it happen in the church, or feel like you really don't have to have any knowledge about it, we need to be informed, we need to be educated.
Definitely. So as Dr. Swift said, those are excellent tools and things, because like we do for anyone that we lose, right? We do hold funerals or ceremonies, to go through that grieving process and get that closure, right? Which we don't see a lot with miscarriages, because a lot of times you'd go home with nothing. The baby was too small, and usually at that age, in the first trimester, what you typically see is blood, clots, tissue, more than the full formed baby. But that doesn't mean that you can't do the same thing that you would do for a person like your grandfather or your father or mother, whoever passed away that you loved. It's still somebody that you loved. So I think that we should all encourage it and be okay with it, and that helps acknowledge and helps people move through the grieving process and be able to move forward and not get stuck kind of spiraling mentally with that.
Right.
Because it is healthy to grieve. It is healthy to let it out.
Absolutely.
And seek help when you need it. It is totally healthy and recommended. If you need therapy alongside medication, it's both combined have been proven to really help.
Yeah.
And there's no shame in that.
Absolutely, there's no shame, and the more we're educated about it, and the more we talk about it, I think the more comfortable people feel that just your counseling just by itself. That people have on the last show we talked about the stigma of just being, seeing a counselor. In this day, and not just with miscarriages or pregnancy loss, but just this day and time, so many things have gone on and so many lives have been changed, and people just deal with things differently.
Mhm.
And whatever it takes, and I believe with all my heart, whatever it takes to get you through that situation, you need to do it. It's self-care.
Right.
My husband came down this morning and he said, the new word I'm hearing is self-care, self-care. And I said, well, what does that mean when you're talking to me? He said, self-care. That means I got to keep Michael first, self-care. And that's important. That's important, especially with a pregnancy loss. You know what you need. And even if you can't pinpoint what you need, hopefully family around you can help you maneuver through that.
Right.
Yeah.
The reason why I wanted to focus on the mental health component of it is you do have the whole physical component of a miscarriage, but the mental health part is what typically takes longer. You might be bleeding for a few weeks, that goes away, but the loss and the grieving, that takes a while. And the concern there really is, if you're not able to grieve in a healthy way and move forward, you might bring this anxiety and stress into your next pregnancy. And that can affect it as well, because anxiety is linked to increased risk for miscarriage as well. So you don't want to be bringing that into your next pregnancy if you can at all help it. And it's normal. It will be normal to have a level of anxiety because you are scared. You're scared it's going to happen again. And most women at that second pregnancy might not bond with the baby right away. They might wait until after that 20-week mark, kind of waiting and seeing, okay, is it, going to happen this time? But it is important that at some point you do start bonding with that baby. And there's many things you can do to help relax and try to reduce that stress and anxiety while you're kind of, going through the stages of the new pregnancy. But
well, how do you decide? And I know there's probably not one specific time for any one person, but just in as we share in education and information today, how would a person help decide? Am I ready to try to get pregnant again, or how can we help them?
It really, like you said, it is there's no definitive time. If you are physically healthy, you've had your checkups, and your partner's had their checkup, and you find yourself in a place of peace, and you're saying, I'm gonna just go through this one more time and really just pray, or do whatever, meditate, whatever your beliefs are to kind of get through it, and you're ready to try again, then you are more than welcome to go try it again. But like I said, the best thing you can do is to really find some hobbies or routines, things to help you kind of keep that level of stress and anxiety down as much as possible. For me, it was kind of like a coping mechanism because I did experience a miscarriage. I kind of tell my friends and family what I did was turn my brain off. I just stopped thinking. I just stopped thinking. I was not pregnant. In my head, I was not pregnant. I was still taking care of myself the way I was supposed to. I would take my prenatals. I would do everything, stay away from alcohol, whatever I had to do. But I would kind of immerse myself in work and just do what I could to take my mind off it and forget that I was pregnant and just live my life. And eventually, we got to the 18-20-week mark, everything was still good. And at that point, I started kind of opening my heart up to this next baby and fell in love with it. And thankfully, everything went just fine. So that's what I did.
Okay.
So.
But I think I like the part where you said that you turned your mind off from your pregnancy, but you still did the things that you needed to do to take care of that baby. And I think that's really important. People realize that you turn your mind off. That doesn't mean that you just act like still do what you need to do, but you try not to stress and cause additional anxiety. That's a really good point. That's real good because and a lot of people, I've heard people say that they won't tell people that they're pregnant until after the third,
right?
The third week. What is it? The first trimester.
The first trimester is about 13 weeks.
Yeah,
and then second trimester will start at 14 up. But
Yeah, but
they will.
it's what I hear say goes back to what you said is what's comfortable, and what is comfortable for you, and what's comfortable for your spouse, and for you to move forward with that. But I like the way you said that because that sort of to this heavy conversation to just add in there that there is possible just because you did have a loss doesn't mean that you cannot get pregnant. That doesn't close all the doors. So you want to we have we got 2 minutes. So talk about the bliss part.
Yep, I'm getting to that. Don't want to leave everyone on a sour note.
Yeah.
So the good news is, and I'm hoping your providers tell you this when you do experience a miscarriage, because this could help with reducing anxiety and stress and all that. 85% of women, so that's a lot, 85% of women who've had at least one loss will have a successful pregnancy the next time. And 75% of those who've experienced 2 or 3 losses will have a successful pregnancy the next time. So those are pretty good odds.
So say those odds one more time.
85%, 75%. Those are high odds of having a successful pregnancy the next time that you get pregnant.
Yeah. So see, there it is. There's a what is a silver lining?
There is a silver lining.
Yeah. And this sort of just wrapping up a little bit. Do you mind, Alison, Dr. Swift, you were the one who mentioned about the support groups. Just tell us a little bit more about if there's a specific one that you just shared with us again, just refresh our memory again about the support groups.
Yeah, sure. I can go through those again. So one is called Empty Cradle. One is called Share Pregnancy and Infant Loss Support. One is Heartstrings Pregnancy and Infant Loss Support, or Pregnancy After Loss Support. And one is Rachel's Gift.
Okay. All right.
And then, of course, like I said, check Facebook, check with your churches, check. Sometimes even the OBGYN clinics may have resources that they may know. There could be a support group somewhere else that they're aware of, so you can also check with them too.
Absolutely. And probably the health department, sure, would be another resource. Yeah, that's great. And just know that you're not alone, and there are more people that have experiences than you can even imagine or that you even think of.
Those would be great resources and support for you as well.
Yeah. So just wanted to say thank you, ladies, again for being here. This was a heavy conversation, but I think you guys shared some very valuable information with our audience, and I do pray that people have received this and they will be able to take this and help make their families better and support their families and support each other through this process, because I just want everybody to know that you're not alone. And again, I'm your host, Wendy Bridgers, and we are here on Family Health Matters, Awesome Radio 106.9 FM every Thursday from 3
Hi,
to
I'm
3:30.
Pastor Jeffrey Cox, pastor of God's Way Church of God in Christ in Kinston, North Carolina, and I'm listening to Awesome Radio 106.9 FM.
Partial funding for this program is brought to you by CT Cleaning Service, 919-345-5823. Nationally certified and bonded for COVID cleaning, commercial and residential, and for all general cleaning. CT Cleaning Service, 919-345-5823. Have a peace of mind that your place of worship, your office building, your home, and your place of work have been nationally certified COVID cleaned, disinfected, and sanitized. 919-345-5823.